Hi, this is Dr. Rob Endicott of the Quayside Dental Practice. Thanks for watching this video. This is a little video about root canal fillings. If you've got an infected tooth or a tooth which is giving you horrendous amounts of toothache, the sort of toothache that makes you want to cut your own head off, the sort of toothache that keeps you up all night and just drives you up the wall, or if you've got a very, very deep cavity in a tooth, it might be a sensible idea to do a root canal filling before we then put something substantial on the top. But if you're getting any of these symptoms, any of these problems, then a root canal filling can help you to prolong the life of the tooth for quite a few years. Root canal fillings have had an extraordinarily bad press over the last 20 or 30 years. And this mainly comes from the fact that sometimes we're not able to completely numb up a tooth. You put your local anaesthetic in, your lips and your cheeks and your tongue is all nice and numb, and yet, amazingly, the tooth is still alive. We know now why that is, but in days gone by, the dentist would quite often not believe the patient when they said, "I can still feel something," and you just say, "Well, it's numb. There's nothing, nothing we can do." But these days, things are fortunately completely different. We have amazing anaesthetics that numb up the tooth really, really well, and we also have techniques to use that in case those really hot teeth that won't settle. There's some fantastic techniques we can actually use to just numb up that particular area, and they work an absolute treat. Even if we can't do that, what we won't do is we won't carry on doing the treatment if you can feel anything at all. It's just not worth doing. But we can put some dressings inside the tooth, and we can actually get these dressings to kill off the inside of the tooth for us. Then we can come back to it a week or so later, and it's all nice and easy. A root canal filling basically is you are taking the core of the tooth, the inside of the tooth, out of there. So all those little live nerve endings and blood vessels on the inside of the tooth, they all go. And then you clean and you disinfect it all so there's no bacteria in there, and you fill it all up. What we often say to patients is when you've had a root canal filling done, quite often the tooth on the top is not in a very good condition. It's structurally probably very, very weak. So it's a really good idea to then put a crown, a cap over the top of the tooth, like a thimble, that then completely covers and completely supports everything and stops things from breaking off. So yeah, that's basically a root canal filling. And if this is of any interest to you, give us a call. Our phone number is 01323 472 772. We'd be delighted to hear from you.